what's the difference between a harm level citation, a no harm level citation, and an immediate jeopardy citation?
That's a great question. It is, it does feel very complex, I think, from someone coming from the outside. I know it was to me when I first started, but there are things that I think are helpful for residents and families and ombudsmen and people working with residents' families to understand here. So essentially, as I mentioned before, the state surveyors, they come in and there are two ways in which the surveys come in. One is through an annual inspection, and every nursing home in the country that's licensed under Medicare and Medicaid is required to have to be inspected, between 9 and 15-month period, with the average being annually, being every 12 months in each state. And so there is the annual inspection, as we call it, and there's also complaint investigations. As I mentioned before, the resident's family members, staff people, even ombudsmen and others can file a complaint. The complaint could be anonymous with the state survey agency, generally State Department of Health or Department of Public Health, and the state has to respond to that in different ways, and actually different ways based upon this scope and severity matrix. So what happens is when a facility is inspected by a surveyor, whether it be for an annual inspection or for a complaint investigation, the surveyor is looking to see, is the facility in compliance with federal standards and any standards that exist within the state. And when the surveyor finds that a facility is out of compliance, that's when this matrix comes in. And what this matrix actually does is it gives the surveyor, the survey team, a way to rate the seriousness of the violation in terms of its scope and its severity. And scope means whether very few people were affected, whether it's something that several people or a number of people were affected by the violation, or whether the violation is widespread in the facility. And Eric is circling in blue the top there. So that's the first thing that the surveyor does after they have substantiated, okay, there's a violation here. Okay, so what is the level of the violation? Is it, for instance, one person who had a medication error, or are we seeing a pattern of medication errors, for example, in the facility, or is it very widespread? Are we seeing, throughout the facility that there are some serious issues? And then the second thing, so that's the scope. The second thing that the surveyor does is they rate the severity of what the problem is. And that's the first column here. And that goes from the bottom, no actual harm with potential for minimal harm, to no actual harm with potential for more than minimal harm. That is not immediate jeopardy. And then the top two are actual harm, that is not immediate jeopardy, and then immediate jeopardy to residents' health or safety. And just as a side note, we have a lot of information for consumers and for the public on this grid and what all these things mean on our website. So you can go back and get more information if you're faced with these issues, if your facility is cited, et cetera, and you want to get a better idea of what was found. But, to come back to this matrix, is that the surveyor is again identifying the extent to which residents and the facility were affected, and the extent to which the problem caused harm. And again, whether it was no harm or immediate jeopardy being the highest. This is really important to us and to other people who are concerned about the quality of care in nursing homes, because unless the surveyor or the survey team identifies harm or immediate jeopardy when they do a citation, there's almost no chance that the facility will face any penalty whatsoever for the violation. So conversely, what that tells nursing homes, which are mostly run by corporate organizations, for profit, but even the not-for-profits are run in quite frequently in a very corporatized manner. What that tells the operator, if they get a no harm deficiency, it means, yes, you got cited for substandard care or abuse or neglect, but you're really not going to face any penalty whatsoever. And of course, our concern as consumer advocates is that sends the message, it's okay to provide this level of substandard care without having, and you won't get penalized. You'll continue to get paid, but you won't get penalized. And as Eric is noting here, 95% of all healthcare citations are cited as not causing either harm or immediate jeopardy to a single resident in the facility. And this has been, since we first identified this in one of our early research studies, this has been pretty consistent over the years. We've done a number of studies in the past 15 years, each looking at several years of data, is that about 95% of the time when a state surveyor comes in and does substantiate substandard care, 95% of the time they say it's no harm, and therefore the facility essentially gets off scot-free and gets paid again for that level of substandard care, which is very disturbing to us, and I think should be disturbing to anyone who's concerned both about resident care and dignity, but also about the integrity of the money that we as taxpayers pay to nursing homes. Most nursing home care is paid for by the American people through Medicare and Medicaid. And so are we getting good value if these citations, these deficiencies are out there and they are not being penalized, and we're paying for essentially a lot of substandard care? So it's a very big issue, and it's one of the biggest goals of our advocacy is to try to improve the identification of when a resident is harmed or when a resident has been put in immediate jeopardy. And just a quick note on that. So harm means that there's been harm. And harm includes, it's very important, according to CMS, the federal oversight agency, harm includes psychosocial harm. It doesn't have to be that someone's bleeding. It doesn't have to be that someone died. It doesn't have to be a harmful medication error or pressure sore or a painful fall. It could be psychosocial harm, counts as well and is as important. Another really important point to make is that CMS also does not distinguish between people who are people who have dementia or Alzheimer's or other forms of dementia and other residents. So for instance, if a resident with dementia is humiliated, put down, maybe yelled at by a certified nurse aide, or the nurse aide sexually molests them, or the nurse posts pictures of the resident sitting in a diaper on social media, it's not an excuse that that resident has dementia and didn't understand that they were being humiliated. CMS requires that the surveyors use a reasonable person standard. What would a reasonable person in that situation find emotionally harmful or degrading or humiliating? And so that is really important. Again, it's important to note that the rules are really strong. The characterization of these rules is really strong. But as Eric noted when he typed out 95% of citations are no harm, unfortunately, what we found and what others have found over the years, many others, government studies, of course, as well, have found is that the surveyors tend to do a very poor job identifying when a resident has been harmed or when they've been put into immediate jeopardy of their well-being. And so that is a real problem. We, along with the Center for Medicare Advocacy, have a bi-monthly newsletter called the Elder Justice No Harm Newsletter. Elder Justice No Harm Newsletter. And every 2 months, we publish this and we highlight citations that are so-called no harm from around the country to allow people and to highlight how these no harm deficiencies, I think for the most part, a reasonable person would say that actually harm did occur here. If a resident, for instance, has been found, as we've seen, to be crying out in pain because they were put into a wheelchair and the wheelchair did not function appropriately and they fell out, or their leg was dragging and they were crying, stop, 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 and the CNA nurse aide didn't stop and they were in pain, and that was a citation, but it was a no harm citation. I think a reasonable person would say, okay, that person who was crying out in pain was pretty obviously harmed, and there's something wrong here with the way that our state surveyors across the country are identifying the extent to which residents are harmed by substandard care. So this is really, and again, just to get back to what residents and families and ombudsman can do, is that when a facility is cited, it's called the statement of the deficiencies. The citation statement is available by the facility. This facility has to provide it to the public, but it's also available on every state's nursing home website, as well as on the Medicare website, Care Compare, and you can see for your facility what their citations were for the last 3 years, what the description was of what happened, and also on the state websites and in the facility, what that plan of correction is, what the facility says it's going to do to ensure that that problem has been adequately addressed. And those are powerful things that you can use as a family member, a family council, resident council, ombudsman, etc., to hold your facility accountable for addressing those issues.